wonder how many times I rehearsed this speech thinking I'll have a dry eye. It's not happening. So forgive me. Good afternoon, everyone. Thank you all for being here today. This is more than an opening of a clinic. It's the beginning of a new chapter, caring for our community. You know, I have had so many people ask, have you always wanted this? So why did you decide to do this? And in so many ways, family, friends, applicants, I don't know how to explain it to them. But I'll say this. When I had my first kid, I realized something. It's one thing to learn the theory in the classroom. We can sit down and learn. It's one thing to also shadow the older doctors and see with your eyes, but it's different when you experience things. So I was fortunate to train in a heavy program that was pretty heavy in OBGYN. So that really changed my perspective after I had my first kid. That, well, you have to show more empathy. You have to be more compassionate. Really what you're reading in the textbook and what you're going to go through for 9 to 10 months, it's different. So why I brought that story up is just to say, when people ask why this, is the experience. As a provider, I have been on the, I would say, other side, and the other side is always when you're the patient staring at your own provider. In different roles, ambulatory care, emergency care, you name it. But coming out of those visits, it mattered to me that I was heard, that I was listened to, and that I got quality care. And most times, it wasn't always like that. So the other person realized, oh, they're dealing with a physician. And then it's like the book flips. But that shouldn't be the case. In any circumstance, it shouldn't. You should do your best, do no harm, and just deliver quality care. And if you don't know all the answers, oh, we have specialists, you know? But at every point in time, you just want to give your best. When I first chose family medicine, it was because I believed in something simple but powerful, that healthcare is more meaningful when it's personal. It's about the relationships, it's about trust. It's about walking with patients and families through every stage of life, from newborn visits to chronic disease management, from preventive care to difficult diagnosis and everything in between. Yes, you might find yourself even doing a little bit of palliative care if that circumstance arises. This clinic was built on that belief. Our vision is to provide care that is accessible, compassionate, and comprehensive. We want every patient who walks through these doors to feel seen, heard, and valued. You're not just a number. I know what it feels like. We want families to know that they have a medical home, a place where their concerns matter and where their health is a shared priority. I strongly believe primary care is the foundation of a healthy community. When we focus on prevention, early detection, coordinated care, and continuity, we do more than treat illnesses, we strengthen lives. We reduce suffering and we empower people to take ownership of their health. One of the things I enjoy during my patient visit is explaining diagnosis to my patient. I just don't want them coming in to say, you have all the answers, you know, you tell me. But I also want them to understand, how did we get here? Because that little explanation can make the difference in how compliant they are. But no clinic succeeds alone. So this is the time I just want to tell everyone, thank you. So the Burnsville Chamber of Commerce, thank you. Mayor Kaufman, thank you. And I have to say this, I had to Google in the city, who's my mayor? It would not be good if I did not know that. So I just have to say that. To our current and future staff, thank you for wanting to go on this journey with us. We have Ms. Tasha Jones here.